Good afternoon and welcome to the St. Clair County EMA COVID briefing. I'm joined today by Chairman Mark Kern and Samantha Bierman from the St. Clair County Health Department. Sam, you have the numbers. Welcome back.
Thank you. I do. Unfortunately, they are not some of our better numbers for our daily totals. But as of today, 169,735 St. Clair County residents have been tested, which is an increase of 1,170 from yesterday. We are at 16,684 positive test results, which is an increase of 254 from yesterday. And that does include both males and females from under the age of 10 up to their 90s. Today, our daily county positivity rate is 21.7%, and we are at 153,051 negative test results. We do have additional deaths to report today. Today, we have a total of 12 new deaths. The first, a male in his 30s. We have a male in his 50s and a female in her 70s, all with underlying health conditions. Then we have 2 males in their 60s, 2 females in their 70s, 2 females in their 80s, and 3 males in their 80s, all with unknown health conditions. And as always, our sympathies go out to their families. For those who have completed the IDPH required 10-day isolation period, we are at 13,998. For state totals, 11,178,738 have been tested, and we have 796,264 positive test results, which is an increase for the state of 8,691. And for deaths, the state is reporting 13,343, which is an increase of 90 from yesterday. For St. Clair County hospitalization numbers, we have 95 patients that are admitted due to COVID-related reasons, and 5 of those are on ventilators. Regionally, we have 216 patients that are admitted due to COVID-related reasons, and 21 of them are on ventilators. For our congregate living facilities that are currently or previously in outbreak status, these are cumulative numbers, and we will only announce any facilities that have had changes. Cambridge House of O'Fallon has 19 cases and 1 death, and that is an increase of 1 death for that facility. Cambridge House of Swansea has 9 cases and no deaths. That's an increase of 7 cases for that facility. Caseyville Nursing and Rehab has 145 cases and 7 deaths, and that is an increase of 2 cases and 3 deaths for that facility. Integrity Healthcare of Belleville has 67 cases and 2 deaths. That is an increase of 1 death for that facility. St. Paul's Home in Belleville has 87 cases and 17 deaths. That is an increase of 1 death for that facility. And Willow Creek Nursing Home in Belleville has 2 cases and no deaths, which is an increase of 2 cases, so they are new to our list today. Before I turn it over to Chairman Kern, I do have a few quick things to touch on. Some of you may have been aware that there is new guidance out that was put out by IDPH late this afternoon regarding the times on quarantine. Since that did just come out today, we are going to make sure that we read completely through that documentation, have clear understanding of it, and we will be discussing that in further detail tomorrow. And EMA did receive some questions on some guidance that IDPH put out earlier this week on essential caregiver guidance in long-term care facilities. So this guidance provides guidelines for long-term care facilities and nursing homes on the appropriate use of what is called essential caregivers, or EC. And that is to provide companionship and assistance to residents for activities of daily living and other assistance that they may need. While IDPH understands and acknowledges that restricting family and loved ones' access can be good in the sense of, helping to slow the spread of COVID-19, they also understand that prolonged exposure to not having access to your family can be detrimental to those residents. So many states have developed guidance to allow for these essential caregivers to come into these facilities. If you have any questions about a specific facility, please check with that individual facility. Every long-term care facility may have different policies and procedures. And do please keep in mind that the most important part of this guidance is that those essential caregivers cannot be in the facility when they are in outbreak status. So that is a major component of being allowed to come in under that essential caregiver guidance or not. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. Terrible number on the deaths today.
It
Just
is.
devastating.
It is.
12 is the highest we've ever had, and just it's a real shock.
It is, and as we kept going through the day, we check with our coroner's office almost every day, to make sure that our numbers are lining up. And when we got the email this morning, I had held my breath hoping that we had already received some of these. Some of them were perhaps not COVID deaths, but unfortunately, we did have several that were.
Just our, as Sam said, our thoughts and prayers go out to all the families. Just devastating news. We'll move into the zip code report. These are the changes in COVID positives in these particular St. Clair County zip codes. 62201 up 7 to 410. 62203 up 7 to 419. 62204 up 7 to 267. 62205 up 8 to 415. 62206 up 6 to 820. 62207 up 2 to 404. 62208 up 18 to 947. 62220 up 11 to 1,124. 62221 up 28 to 1,562. 62223 up 24 to 1,019. 62225 up 1 to 83. 62226 up 27 to 1,779. 62232 up 4 to 556. 62239 up 5 to 247. 62240 up 1 to 82. 62243 up 9 to 359. 62254 up 3 to 529. 62255 up 2 to 42. 62257 up 6 to 166. 62258 up 9 to 625. 62260 up 11 to 396. 62264 up 7 to 203. 62269 up 42 to 1,732. 62282 up 1 to 43. And 62285 up 3 to 326. As Sam said, 1,170 tested. Out of those, 254 are new positives, which brings our daily county positivity rate to 21.7%. That's up about 6% over yesterday. Way high jump. We shouldn't have those kind of jumps, but we see that today. That takes our regional positivity down to 15.1%. And the county 7-day rolling average then is, according to the state, is 15.4%. So the county 7-day rolling average is 15.4%. That's up 1%. The regional positivity, that's the state number as they have us, it's down today to 15.1. That comes from Bond being at 5.3%, Clinton County 9.4%, Madison County 11.1%, Monroe is at 23.2%, Randolph at 24.3%, St. Clair topping today at 25.1%, and Washington County at 14.8%. So numbers are too high. Everyone knows what we need to do. We need to wash our hands, watch the social distance, and wear these masks. The masks are the way that we can keep this spread from happening. We've got to be able to get through December and January to a point where we're starting to give out the vaccines, and we see that the vaccines are starting to work. Until that time, masks, social distancing, washing your hands, that's the way that we can, the only way that we really have available to control the spread. Luckily, medical science has helped with the treatments in the hospital. Unfortunately, 12 new deaths today shows that it's still a very nefarious virus, one that attacks people and makes permanent changes in many lives. So we have a call with Washington that we're going to be doing this afternoon, Brian. So I think I'm going to...
Coming up very shortly, a call to go over the vaccination rollout, and so it's going to be interesting to see this coming from a federal level. If anything changes on what we're already prepared for from what the state has prepared us for. One last thing I do want to mention, though, before we wrap up today, is testing. Testing is always important. We've talked about the site being out at St. Clair Square 7 days a week. But remember, tomorrow and Wednesday, 8 to 4, at McKendree University, we've got a mobile testing set up. So anybody that feels they might have been exposed, put in a precarious situation, it's never too late to get tested, and that way you can make sure you're safe for that day at least.
And that you're not spreading this virus. You know, that's the key. The key is to get this contained. To anyone that has it, that they are quarantining, they're isolating, they're not passing this along. Obviously, there's a lot of passing along of the virus going on. 21.7% positivity. It's a general spread in the community. There is nowhere, no zip code in St. Clair County that has not been impacted by this virus. So let's all band together, do the right thing, and we can make it through this pandemic. We've got a couple months to go. I mean, it's wearing on, certainly on us, but think about the wear that it's having on our doctors, our nurses, our medical community, all our frontline workers out there that are working on this 24 hours a day and facing this day in and day out. Our prayers go with them, because they're the ones who are really taking us through this. But we've got to help them. We are, in a sense, the front line, another front line, to be able to make the numbers manageable in our healthcare facilities, so they have the capacities available to take care of people should they get sick, because people are going to get sick. No matter how careful some people are, they end up catching this, and we need to make sure that we have available staff to take care of them, as well as people who have heart issues or strokes or other things that are common occurrences that happen every day in the hospital. We've got to make sure we have available staffing and beds for those people too.
Absolutely. We thank you for joining us for the last 269 days. We'll be back with you tomorrow for day 270, and we'll be back here just shortly with Cindy and Daisy to transfer this into our Spanish communities. Thank you.
We must find a way to live with COVID-19 until a vaccine is ready. One proven thing we know is that masks do work. By wearing a mask, you can do your part to help your community by limiting the spread of the virus and thus helping our businesses remain open and our hospitals able to handle the capacity. To get through this virus, we must work together as a team, and you should do your part by wearing your mask, washing your hands, and watching your social distancing.